So let's talk a bit more about my course, The Business of Physio 101. Canadian physio programs teach us anatomy and assessment and treatment, but they don't teach us how to negotiate a contract or understand your pay structure or even just like how a clinic operates, right? Most new grads, myself included, enter the business of physio uncertain of how billing works or how long it takes to build a caseload or how to keep that caseload. What does a fee split really mean? Am I an employee or an independent contractor? All these things were things that we had to just navigate and figure out as, my cohort of fellow classmates, we kind of zigzagged our way through it, right? So the business of physio bridges that gap. What it is an 8-week live course. So I'm going to be teaching, administrative skills and financial understandings and, contracts, employment models, and just the basics of how a clinical business operates. I'm going to be teaching this live. So it's going to be an 8-week program. Every week is going to have a live call. Each call will be about an hour and a half to 2 hours with a different theme. And we'll go over what each of those weeks are going to look like. But at the end of it, what I really hope is that everyone who takes the course comes away feeling empowered, competent, and confident in applying for jobs, understanding their contracts, and really just knowing how the inner workings of a private clinic operate. So, who is this for? This course is for final year healthcare practitioner students in BC and Canada. So, obviously, my background is as a physio, and I tend to speak to physiotherapists. But this information is ubiquitous for RMTs, chiros, counselors, OTs, even physicians, people who work in a private healthcare clinic, or work in a healthcare clinic at all. Right. So, anyone who works in the private sector as a clinician is going to be subject to a lot of all of this stuff. Now, obviously, my expertise is in the world of physiotherapy, but the insurance problems that we see in physio also apply to, counseling, RMTs, chiros, etc., kinesiologists, all these people, right? Osteopaths, acupuncturists. So this isn't exclusive to physiotherapy by any stretch of the imagination. Even, like dental hygienists, different like dentists. I'm not an expert in, like the dental billing, let's say. But anyone who might work at a private clinic is going to be affected by most of the things we're going to discuss. So this is, yeah, for final year students or for new grads in any of these healthcare professions. It's also for internationally trained clinicians who are transitioning back into Canadian practice, right? So maybe you've been trained abroad, worked abroad, but you're uncertain of how the landscape looks in Canada and would like to dive into that. It's really just for any early career clinicians who want clarity on billing, contracts, compliance, like in just that inner working of a physio clinic, right? So for anyone who is literally thinking like, why didn't we learn this business stuff in school? This is for you. So, the transformation you can expect. So, by the end of the program, I really hope that you'll know what to look for in a clinic and understand the inner workings of how a private healthcare clinic typically operates. So, I want you to know, like, how to spot an employee model clinic or an IC model clinic, or, like just to be able to understand how billing works, how administration works, what's HR, what is finance, what's bookkeeping, just what all the different sectors of a business are. I want you to understand how to sustainably build a caseload. So building a caseload and maintaining a caseload are very different things. So I want you to be able to do both of them, understand the difference there, and how to do it without burning yourself out, right? I want you to feel confident negotiating contracts and fee splits and have a deep understanding of what each of them means, what all the clauses in your contract mean. And I really want you to truly understand how you're paid, right? So, like, we're going to go over all the compensation models that exist out there, and how you can also plan for taxes if you're an independent contractor, because it's a huge factor there too. You're going to learn the basics of ICBC, WorkSafe, and private insurance billing. So, how those work, what the typical fee structures are there, and how just the administrative part of that works. So that you can just hit the ground running, and also trust that if you're working with an administrative team, that they have your back and they understand all of these things too, right? So, sometimes just trusting people but not having an understanding yourself can be a scary thing, right? So, um, empowering you with that understanding of how the direct billing component works. You're going to know what mentorship models can look like and how to ask for them effectively and in alignment with your goals and if they're even appropriate or not. And ultimately, you're going to just build a career plan that matches your professional goals, your desired finances, and your lifestyle. So I really hope that by the end of this, you're going to leave with tools, templates, and a deeper understanding of the business of physio and the business of private healthcare in BC and Canada. So yeah, 8 weeks, live classes. They're going to be an hour and a half to 2 hours each night with lots of Q&A and interaction. I'm going to be leading them. We're going to start in the spring. So March 11th is a Wednesday. We're going to start that evening. I think we'll start kind of around the like 6 or 6:30 p.m. mark, do it in the evenings. All the calls are going to be recorded. They're going to be available in your dashboard. That said, I would strongly encourage everyone who registers to be there live because that's where the real interaction is going to happen. Your Q&As are going to be answered there, and you'll just see everything happen in real time. You'll get a private dashboard. So, it'll be hosted on a course website that gives you a dashboard where you can communicate with other people. We'll probably have a Slack channel or a WhatsApp group or something where we can all kind of ding ideas off of each other. But there's going to be things like templates and checklists and just different resources in there that'll help you in your career navigation. Yeah, we're gonna have a community space, so haven't quite decided on that modality yet. Could very well be Slack, where we all can chat with each other, right, and support each other even beyond the course's completion. And then lastly, there's the option to actually upgrade right now for a one-on-one mentorship call with me too. So we'll do the call when the course is done so that you'll have all the information you could possibly need, and then we'll discuss your unique scenario and how I might be able to support you with that. So I'm limiting availability on that. There's only going to be 10 of those mentorship option upgrades. So if this is something that's interesting to you, definitely register ASAP because it's a pretty good deal for a one-on-one call with me. So yeah, would love to have you in my consulting practice within that. Um, yeah, so every week we'll have a different topic. Week one will just be kind of an overview. We're going to look out at the starting in private practice, so just kind of like the overall mechanics of a clinic and how to choose the right one. We're going to move into week two, building your caseload. So, like what does that look like? How to refer. We're going to talk a bit about marketing there. Number three, we're going to talk about money, different employment models, incorporation. We're going to talk about financials and taxes. From there, week four, likely going to look like contracts and negotiations. So, how to advocate for fair terms, what the contracts mean, what different clauses are in there, and just really understanding that piece of it. Week five, we're going to look at insurance licensing and billing. So we're talking about the different types of insurance you need professionally, legally, commercially, all of these things. Business licenses are a big part of this. We're going to talk about extended health billing. So, that's where all the ICBC WorkSafe and private billing components are going to come in. We'll talk a little bit in week six about professional growth. So your continuing education, specializations. We're going to talk about niching and different career pathways that exist beyond the traditional treatment models. Week seven, we're going to talk about lifestyle and balance. So like charting, administration, boundaries, avoiding burnout, all of these things. And then week eight, we're going to wrap up with a future outlook. So we're going to talk a bit about, is clinic ownership something you want to work towards? Do you want to contract? Do you want to go into education, academia? What are different career options within there that you can explore beyond, just working at a private clinic? So, yeah. And again, that is subject to change, especially with feedback, right? Like as people are registering and have questions and, hopes and requests for things to learn, I am totally open to like modifying the curriculum to make sure everything gets answered that you could possibly want to know about being a new clinician and the business of that. So yeah, totally open to your input on that. So, I'll be teaching it. I'll be your live teacher every week, in addition to some Q&A from everyone in the group. Right now, the standard enrollment is $499, and that's for the full 8 weeks. And right now, I've got an early bird rate on, so take $100 off of that if you register before January 15th, 2026, which also happens to be my birthday. So my birthday gift to you is my early bird rate. And then after that, it will be going back to the standard enrollment of $499. And like I said, there's a mentorship upgrade. So for $100, you can add on a call with me after the course is complete. And that's limited. There's only going to be 10 of those available. So, yeah, would strongly encourage you to take a look at that. So, some of the FAQs, some of the questions that I've had, one, will they be recorded? Yeah, absolutely. You'll have access to the replay in your dashboard. They'll only be there for a limited amount of time. It won't be like a lifetime option to see the replays. So, haven't decided how long I'll leave them up there for, probably 6 to 12 months afterwards. Beyond that, I'm not sure how much longer you'll have access to it, but yeah, they will be recorded. Number two, can I join while I'm still in school? Absolutely. It's actually the best time. I've even kind of timed it with the schedule at UBC. So, thanks to Chelsea, I've been able to chat a little bit and get some info about what the timeline looks like there. So I've actually planned the timing of this in March, specifically so that the students at UBC are going to be on placement, so that it's not as like heavy on exams and assignments. Um, and then, yeah, it kind of bleeds into the beginning of another round of schooling, but it doesn't interfere with any exams or assignments or anything like that. So I've selected this time frame specifically so that it doesn't interfere with any like heavy workload in the program for the second years at UBC. Number three, do I need to live in BC? Absolutely not. This is like a lot of this information, even though, I use the words ICBC and WorkSave, they're interchangeable for other insurance companies all the way across Canada. So even if you're not Canadian, you don't have to, you can be anywhere. A lot of the business principles that are going to come through this program are general business principles that apply anywhere. Now, obviously, my lens is BC and Canada, so it's going to be focused on healthcare clinicians in that realm. But, a lot of the lessons in here are applicable to people all around the world. Marketing and relationship building and, caseload building, these types of things are all, things that are important to learn across the globe. So, no, don't need to be in BC. Next question. Will this help me open a clinic? This isn't the course for clinic owners. Nope. This is foundations, like basic business literacy for new grads. So this is looking at it from more of a like clinician's lens, understanding that landscape. I will be creating another course that will help with opening a clinic. So do watch for that down the road. I am really excited about that. But there will be another course that's actually like the business of opening a clinic and things to consider and everything there. So this isn't the clinic. This isn't the like clinic opening one. This is the overview of the business landscape of private healthcare in BC and Canada and around the world. And then lastly, do I need to be a physio? No, this is not exclusive to just physiotherapists. Like I said, this is information that, we work in multidisciplinary clinics, right? So it might be owned by a physio, but there might be other disciplines working there too, right? So a lot of these agreements, contracts, case building principles apply to many different private healthcare practitioners. So we've got RMTs and chiros and naturopaths and osteopaths and acupuncturists. Who else? Oh my gosh, kinesiologists, OTs, RMTs, counselors, any dental hygienists. I've been rattling them all off here, but anyone who works in a private healthcare setting can absolutely benefit from this information. A lot of it is applicable. Now, obviously, my experience is as a physiotherapist in BC, but that does not mean that this business information is exclusive to physios. So, would highly encourage anyone who's not a physiotherapy but is going to be working in a multidisciplinary clinic to absolutely tune in. So with that, that's as much of the information I have off the top of my head for you about this course. I'm thrilled. Honestly, this is the course I wish I had when I was a new grad. I would have been all over something like this if I could have had a better understanding of how a clinic worked. I probably wouldn't have zigzagged and made as many mistakes as I truly did. There's a lot to learn here. And as much as I wish this curriculum was taught in universities for us, I understand there's so much material for, UBC and the different universities across the country to get through. And it's just not priority because not everyone goes into private physiotherapy either, right? Like A lot of us go into public practice. So, yeah, with that, I encourage you to take a look, danielleboyd.ca/courses, and click on Business of Physio 101. You're going to find all the details there. Registration links are going to be there. Yeah, and I'm thrilled to welcome everyone into this course who wants to be here. So thanks for taking the time.